Hello and welcome to this very first module of the Clinical Nursing Instructor Preparation course. My name is Susan Knowles. I will be your host throughout all of the modules. And throughout the modules there will be embedded videos from other authors and other websites, as well as assignments and articles, and we'll go through those now. This very first module is entitled Transition to the Role. The purpose and goal of this module is to present a realistic picture of the transition process from being a clinical nurse expert to a novice nurse educator, and then to become aware of the behaviors that students have cited as effective for instructors to have. And at the conclusion of the module, you should be able to summarize the process of role transition to clinical nurse educator, and then understand how being a novice nurse educator is actually very much like being a novice nursing student. After you finish this module, you'll have a better understanding of the transition process from clinical nurse expert to novice nurse educator. You'll be able to differentiate between the behaviors commonly associated with a novice versus an expert, and you'll probably be able to give at least one example where you have seen this before, maybe as a new nurse yourself or with new staff members on your unit. You should be able to use some self-reflection about taking on this new role of being a novice again, now as a clinical instructor, and compare that to your current role as a nurse expert. And then I think you'll be able to actually cite those effective clinical nurse educator behaviors that students have cited. The entire course is supported by the National League for Nursing core competencies for nurse faculty. Therefore, I'll be pointing out which one of the core competencies I feel is the most appropriate for each module. In this module, I think that the NLN Competency number 6 pertains to the clinical teaching. Nurse educators recognize that their role is multidimensional and that they have an ongoing commitment to develop and maintain competence in the role, and that is essential. And through this course, you are demonstrating a commitment to lifelong learning to develop your effectiveness in this new role, and it's important to use feedback gained from yourself, from your peers, from students and the administration, and especially from your mentor, to improve and to engage in activities, like I mentioned, the mentoring in this course, to help you become more socialized to this faculty role, because it's really important that you feel a part of the faculty teaching team. For every module, there's an agenda. The agenda for this module is for you to complete the audiovisual portion of the module, hopefully after you have read the assigned articles. And I'll go over those articles in just a moment. There are 4 of them that I would like you to read because I think they're really important, as well as the other articles that are listed on the reference page, which actually give you the background for the information, of course, in this module. I'd like you to reflect on the module content, complete the reflection questions, and then meet and discuss the answers that you have or that you've thought about with your mentor. And then, of course, complete the evaluation of the module, preferably after you've had a discussion with your mentor. In preparation for this module, I suggest you read the following articles for a deeper understanding. All of the articles are brief and they're very helpful. Benner's article From Novice to Expert is a must-read. I wish that I had been advised to read this article, as it would have answered so many questions for me, especially about student behavior. I think it would have helped me to develop more effective teaching strategies earlier on, and it would have helped me to be more patient with my students. I'll talk more about this article later in the module. The articles by Koharczyk are brief. They give you a little understanding of beginning the position as a clinical faculty. And in her first article, delineating the role of the part-time nurse educator, Koharczyk does a good job of reviewing what a clinical instructor does, as well as talking about the drawbacks of the position. Specifically, she talks about the lack of orientation and that part-time faculty are too often excluded from the rest of the faculty, and that's inevitable with the policies and procedures and curricular changes that take place on an ongoing basis with the full-time faculty. And this is why I feel so passionate about this preparation course. Koharczyk, in her second article, Starting the Job, gives some very helpful tips on getting prepared to teach your first rotation. And I'll discuss some of these same ideas in the upcoming modules about the clinical day. I also talk a little bit about this in the Clinical Toolbox module. This article is a great primer for getting ready to teach. Transition to the role is a process that all novice faculty go through, and all too often without any preparation. And let's face it, our nursing education does not adequately prepare us to teach our own. And after all, who should be the best at teaching our own? We should be. However, without preparation, novice faculty often feel frustrated, disoriented, and overwhelmed when we first start teaching. During this time, we're most worried about how to do the job rather than concentrating on how students are doing. Next, we begin seeking more information and seeking help from mentors. And lastly, we begin to see ourselves as both a nurse and as a nurse educator. And this step can take a long time, and for some, it never happens. If we're unable to see ourselves as both a nurse and a nurse educator, then that person doesn't continue in the role. The preparation course is intended to short-circuit this process by providing both the information and a formal mentoring relationship. Interestingly, Benner's 1982 article From Novice to Expert seems as current today as it was when it was written. She found that nurses do go through 5 levels of skill proficiency: novice, advanced beginner, competent, proficient, and finally expert. Both novice students and practitioners are taught rules to guide their actions. And I think, if you start thinking about this, you can actually see that. An important observation is that the novice is unable to use any discretionary judgment. And I could really see that when I would teach students. Because without experience, you're unable to prioritize a clinical situation. And as nursing instructors, we are always asking our students to prioritize. I know in the very beginning, of course, it's very difficult for them, but we keep having that expectation. But if we really think about it, they really haven't had any experience. So how are they supposed to know what comes first and what's the most important thing to do? Generally, a nurse who has 2 to 3 years of experience, according to Benner's theory, is at the competent level. And this is a nurse who can cope and manage many clinical situations. An important observation about the proficient nurse is that this nurse will feel frustrated by rules. And as Benner puts it, these nurses will find exceptions to rules if they're asked to practice by them. And this is because they no longer practice by rules or formulas, and they're using their past experience. And sometimes as a new nursing instructor, we're back here at the beginning where we need to have those rules and guidelines. But then at the same time, when we're trying to teach, we have to think back on what were the first steps that we took so that we can help walk a student through, and as an expert, we've stopped using those rules. So what I'm trying to point out to you is the confusion and the frustration that we can have when we first begin teaching. Teaching novice students requires that the instructor to be able to break down a procedure or an observation back to the basics. And instructors will need to guide students in thinking through a situation that an expert may struggle with because this nurse is now practicing by intuition. The novice student asks for the steps and they want to know a definitive answer. And as experts, we know it depends upon the variables of the real situation. So I highly recommend that you read Benner's article at least 2 times to get a deep understanding of this concept as she explains it. And it will really help you to understand yourself as you make this transition, as well as why the students act the way that they do. Effective clinical instructor characteristics were something that I had no information about. Nobody told me, and it wasn't until I did some research that I actually found some articles that helped give me that answer. So we're going to go a little bit into the research right now. So knowing what students think are the most effective behaviors, I think, can help us to be better instructors if we can learn from what they tell us. And in several studies, researchers used a tool called the Nursing Clinical Teacher Effectiveness Inventory. And it was a 47-item checklist of teacher characteristics using a 7-point Likert type scale. The behaviors were grouped into 5 categories, and they were teacher characteristics, teaching ability, evaluation, nursing competence, interpersonal relationship, and personality traits. Students clearly indicated in these studies that the most effective teachers are those that have the ability to demonstrate the professional nursing role and can fairly evaluate a student's clinical performance. And that's it. Those are the 2 characteristics. While being a role model was identified as important, unfortunately, we don't really know what the students meant by being a good role model. So I think it's for us to interpret. I think we as professionals know what a good role model actually is. And then the second one was being able to evaluate them without embarrassing them. And so that's why in one of our future modules we're going to talk about doing the student evaluation, because it is so important. So what about the question, are we a teacher or are we a facilitator? I know I'm going to continue to use the word teacher, but we really don't necessarily teach. Nursing is a practice profession. Students should encounter real practice problems. And what students do in the clinical practice area is more important than what they can demonstrate in the classroom. And those are not my words. Those are the words of Gaberson, Orman, and Schellenbacher, the text that I recommend for this course. And this makes the clinical instructor's job very important. The teacher guides, supports, stimulates, and facilitates learning. And what we mean by facilitate is that you, as the clinical instructor, design the appropriate activities in the appropriate setting, and then you allow the student to experience that learning. This means that we as clinical instructors look for learning opportunities that are appropriate to the level of the student. Clinical instructors do not supervise. They aren't there with a clipboard just watching what students are doing. They're actually facilitating the learning environment, which is actually the patient care setting, so that students can experience that learning. As teachers and facilitators, we provide the opportunity for the experience. Practice in clinical settings exposes the students to the realities of our professional practice. It also gives the student the opportunity to develop their critical thinking and problem-solving abilities. It gives them the opportunity to have that specialized psychomotor and technological skill development, as well as the values of our profession. The imposter syndrome. If you don't know what I'm talking about, I forgot to mention it in the suggested readings for this module. This is a really quick article, blog post written by Cravens, where she talks about this syndrome that I didn't know actually had a name, but I can admit that in the very beginning I felt this way. Was I really the right person? Was I really ready to be a clinical nurse, expert, instructor, and all that kind of stuff? And I think it's important to realize that if you are feeling a little bit unsure of yourself at this point, you're not alone. The following videos were created by Dr. Kimberly Silver Dunker at UMass. She also has the videos posted on the Quality and Safety Education for Nurses website, or QSN.org. She has given me permission to share them with you. In this first video, the novice faculty member shares advice that has helped them. In fact, there are two different faculty members that share their advice. I think the information that these instructors share can really help you too, because you're hearing it firsthand. Most importantly, for this particular module on transition to the role, the faculty shares their feelings about transitioning into this new role, and she is honest and said that she really feels scared and she hopes that it didn't show to the students. And I think what's really important about this is that's exactly how students are feeling too. They're feeling really scared too. And this is also supported in the literature. To access the video, go ahead and you'll see the little world icon on the lower left-hand corner of the slide. You can click on that. It'll take you out to the internet to the video. In this second video, also created by Dr. Kimberly Silver Dunker, the instructors talk about their challenges in teaching students in the clinical area. They talk about some real everyday issues that they saw as challenges, and these happen in any nursing program and at any level. You may also hear this comment several times. The rotation is so short. There is such a short amount of time. And this is a real issue in every rotation, no matter the actual length. Even an 8-week rotation goes really fast. They talk about being firm and the importance of consistency and dealing with issues up front immediately. And this is something that full-time faculty, in my experience, have discussed over and over again. So it is really important. So I'd like you to share your thoughts with your mentor. In order to access the video, go ahead and click on the little world icon in the lower left-hand corner, and it will take you right on out to the internet to view the video, which is about 6 minutes long. Now that you have completed the module, I'd like you to consider the questions, and you can write down the answers to your questions in your discussion log and share your thoughts with your mentor. Here are the following questions I'd like you to consider, and that's thinking about the concept of novice to expert as it relates to you as you transition. And then what do you anticipate will be the easiest or the most difficult aspect of transitioning? What similarities do you see between you and your students? And what are your thoughts regarding effective clinical teaching behaviors? Please complete the evaluation, and if at all possible, go ahead and have your discussion with your mentor and then complete the evaluation. Thank you for joining me on this module, and I look forward to talking with you in Module 2, the mentoring relationship.